Thank you, Renuka. Unfortunately, colleagues, we don't have time for questions, so I would just ask a round of applause for the speakers this afternoon. Thank you very much. And yeah, so let me introduce now Katie French from Mosquito Sun. She's Mosquito Sun is the session sponsor for the next meeting that we have, and it's the malaria elimination. So thank you very much to the panels, and we can. Thank you.
Thank you so much. I'm so excited to be here. Thanks to GBC for hosting us and for putting on this session. It's an honor to be able to help convene this great session where we're able to talk about some of these major challenges. Mosquito Zone International is a brand new GBC member and a brand new CAMA member. And part of our goal here is to help disseminate some of what the best models out there are for malaria control, both in the public sector and in the private sector, which is where we typically work. Mosquito Zone runs integrated vector control and malaria prevention programs for companies, both inside the fence, as we call it, that is on the work site, and outside the fence in the communities where our clients' workers may live, but also their families and their neighbors live as well. Our scientists are mostly field-experienced entomologists. So I'm an epidemiologist surrounded by a bunch of bug guys, which makes for some fun staff meetings. But one member of our brain trust is here, Dr. Cole Church, back there he likes to hide in the back and keep a low profile. But Cole runs one of the largest private sector malaria control programs in the world for ExxonMobil and its 6 operators in Papua New Guinea. We're really proud of that program. As I mentioned, we're new to GBC, and I'm new to Mosquito Zone, having just left 10 years on Capitol Hill. But what I did there was oversee and evaluate malaria programs and HIV/AIDS programs that the US government is funding. And what's been exciting to me is I've watched the malaria picture literally transform over the past decade, is just how influential the private sector has been in convincing the public sector that it can be done. And I can tell you, it really was the inspiring examples of companies like the mining guys in Zambia and BHP Billiton, Anglo American, and Anglo Gold Ashanti, and you know, these were the folks that convinced the US Congress and then the Bush administration that dramatic investment in those types of integrated vector control models were worth doing, and worth doing big. So that's why I'm excited today to hear from the Ministry of Health of Mozambique. You know, Mozambique is ground zero for private sector enthusiasm for malaria control these days. And we're looking to scale up there and do more community-based programming and integrated vector control programs. And we have so much to learn from each other. So I really appreciate GBCHealth again for providing these opportunities to unite and conquer. And with that, I won't take any more of your time. I'll turn the microphone over to Dr. Brian Brink, whose fame precedes him as the Chief Medical Officer at Anglo American and the private sector guru at the Global Fund. Come on up and introduce our next speaker.
Good afternoon, everyone. I've got a very special privilege to introduce to you the Permanent Secretary for Health from Mozambique, Marcelino Lucas. He's an extraordinary man. I first met him when he came to my office in Johannesburg. Now, that never happens. You don't get people from government coming to my office. I always go to their offices. Came to my office and sat down and said, we want to work with the private sector. How do we set about it? How do we find ways to deal with the health problems in Mozambique and do it more efficiently and do it in partnership? And it was just lovely to hear that enthusiasm and willingness to engage with the private sector and to move forwards. And in the discussion, I asked, so what are the big health problems? And number one is malaria. Malaria. I think there are parts of Mozambique where the incidence of malaria is simply the highest in the world. It's in a particular province where coal mining is about to take off, Tete province. 60% of the population get malaria every year. I mean, that's extraordinary. That's an extraordinary burden of disease that simply shouldn't be there. And remember that it's mostly the children that are the ones that get it and die from it. And it's just unacceptable. It's just unacceptable that this should be going on. Mozambique is a huge country, a coastline of 3,500 kilometers, population of 25 million, and severe constraint due to lack of capacity to get the job done. I think it's a lovely opportunity for all you here to hear from somebody right at the front line. Marcelino has to deal with these problems day in and day out. And he'll tell you about malaria and how it impacts on that country and the way, his vision for seeing the way forward and working with the private sector. So Marcelino, it's lovely to have you in New York. It's a long way from home, but thank you for coming. We look forward to hearing it. Thanks.
Thank you. First, let me start by asking your patience, because my English is not as good as the one from Professor Brinks. If you ask me in which language I would prefer to speak, I'll definitely say in Portuguese. But if I choose that path, I don't think you'll understand me. Although I saw some Brazilians here in this room, but majority will expect me to speak in English. But I think when it comes to things like diseases like malaria and so on, it's not how well you speak English, but it's what we can feel, what we can communicate, and what we can share. And probably before I move into the issue of malaria, I would like to thank GBCHealth for inviting us. And when I say us, it's not just me as an individual, but it's the Mozambicans. It's the 25 million people that have no voice, and they expect me to be here and share with you their pain. As Dr. Brink said, we have towns, districts, where out of 10 people, at least 6 get malaria per year. That's huge. And we also know that mortality is a big issue. Malaria is the #1 killer for children under 5 in Mozambique, and is the cause of mobility, #1 cause of mobility in the health service in Mozambique. I'll give you an example of the implication of that to our response in terms of budget and resources. We had a program some time ago with support of private sector, in which they worked in eliminating or reducing the number of malaria cases in a specific location. And because the program was good, they managed to reduce in about 75% or more the number of cases. The impact on that was the health facilities in that area were less overloaded. And the impact of being less overloaded was that quality of service improved, because the doctors, the nurses, and health personnel had more time to interact with other patients. And one of the results was the satisfaction of the community was big, just by eliminating one disease, which was malaria. We saw an increase in terms of quality of service and public satisfaction. So that makes us understand that if you want to have a better relationship and better serve our people in Mozambique, we have to resolve the issue of malaria. I'm talking about Mozambique because it's a country that I better know, but I tell you, it's a situation in many other countries of Africa. As an example, the 2 worst districts in terms of malaria in Africa, they are in Southern Africa. One is in Tete, where most of the investments are happening now, and the other one is in Zambia, meaning it's not just an issue of Mozambique. And because our heads of states understood the impact of malaria on the economy, on tourism, and many other areas, they decided to join arms and create what is called ALMA, which is the Prudential Coalition, African Leaders Coalition for Malaria. That by itself shows the huge political commitment that we have to fight malaria. But having just political commitment without joining the energy with others will not make us win. And that's why when we were invited to come here and interact with you, we are very pleased. Because I have the opportunity to be here with companies that have made the malaria war something that we can win. We have here companies that have innovated many different types of mosquito nets. We have companies that have been dealing with like mosquito zone, organizations like mosquito zones and others that are doing their best to find technologies, finding instruments, and even trying to find the right medication to resolve the issue of malaria. And we want to tell you we are real proud of you. We are happy with what you are doing. We think without you, it would have been impossible to have the results that we are having. But it's not good enough. We still have a way forward. We are talking about elimination of malaria in our region. And that elimination will only be possible if we find ways of better coordination, if we become more innovative in terms of how we do things, and if we become more open to partnership. And I believe when we talk about partnership coming from government, it's not just about asking for financial resources. We want ideas. We want new ways of approaching problems. We appreciate your efficiency, so we would like you to teach us how to be more efficient. But we also want to share with you the responsibilities of eliminating the problem. We don't want to have you sitting in one side of the room and us on the other side of the room. We want to be able to be all together and join arms and fight. We have initiated a dialogue with some of our business partners to advance with a concept which is already existing of the social bonds or social performance bonds. And we think malaria can be one of the diseases where we can try that, where we can bring private sector implementing activities and get compensated on a performance-based logic. And we would like to invite you to also consider the possibility of bringing other ideas into the table so that we move from traditional ways of combating malaria to new ways that probably will take us soon to the elimination. We are looking forward for synergize. We would like to have forums where the private sector, the international, the development partners and governments sit together around a table, and we bring what you can bring, the development partners bring what they can bring, and governments can bring what they can bring. It can be logistics, it can be technology, it can be mechanisms of interaction. Whatever idea we have, let's synergize and make sure that malaria is part of our past. I would like to extend my thanks to all of you for being here and giving me this opportunity to communicate. And once again, thanks for helping us to win the fight against malaria, and we count on you for the coming years to eliminate malaria. And thanks you.
It was not part of the program that I was closing this. So I don't know where is Chipo, but no, thank you very much for all of you to join us here. Chipo, there you go. Please come and say thank you to everyone, please.
think what's interesting is that I was expecting Eric to tell us what we needed to do in terms of TB, but it's fine. I think that we are quite clear in terms of our next steps. I think the speakers have made it abundantly obvious that we don't have enough in terms of corporate engagement. We have a little bit. Is there a little bit sufficient? No, it's not. Is it going to ensure that we can eliminate within the next 1,000 days? Definitely not. However, we need to really make a significant effort to ensure that within the next 1,000 days we have traction. But importantly, we are able to actually define, and I always say this to everybody, in my lifetime, I would like to be able to define elimination for both TB and malaria. So ladies and gentlemen, without further ado, I'd like to thank everybody. I'd like to thank all our speakers. I'd like to thank the city of Joburg, where I reside. The mayor has always been a great support, so I'd like to thank MMC Mulelwa. Thank you so much for traveling through. Thank you to Dr. Lucas, Dr. Brink. I always say Dr. Brink is my pillar because he's the SADC private sector chairperson, so as much as he sits at the Global Fund, he really is a great force in terms of the SADC region from a private sector perspective. So ladies and gentlemen, like I said at the beginning, you want to hear more about this, because I think you all do, because everybody kind of is talking to me as you were walking, some were walking out. Please join us tomorrow morning, and that will be Africa Part 2, and we'll be able to unpack all the conversations that we've had here even further and really show you that there is deepening engagement already. Thank you very much.